It's great to visit with you today.
Well,
And
thanks for having me.
Dr. Denmark, you're a cardiologist.
Yes.
However, you have a specialty in cardiology. And could you explain what is an interventional cardiologist?
Sure. So I'm kind of like as I like to think about the plumber for the heart. I think about the heart having three main components: the walls and the doors. That's the carpentry, the foundation, just like the walls and the valves of the heart. We also have the electrical system in our house, and that's generally in the heart. We have our EKGs, and that's treated by our electrophysiologists. And of course, we have the plumbing in the house, and I'm the plumber. When the plumbing gets clogged up, you can have a heart attack, and that's basically what I primarily treat.
And let's talk a little bit more about cardiovascular disease and what type of cardiovascular diseases do you treat?
So basically, I treat anything that comes into the door. Of course, as an interventional cardiologist, focusing on coronary artery disease or blockages in the arteries. But I also see patients with congestive heart failure, arrhythmias such as atrial fibrillation, which is very popular. And then also as an interventional cardiologist and one of the plumbers, I not only take care of, if you will, the plumbing of the heart, but also in other parts of the body, specifically the legs. So people who have peripheral vascular disease, and also those suffering from venous insufficiency and even varicose veins.
Doctor, let's talk about some of the other maladies associated with cardiovascular disease, and more specifically in our limbs, arms, legs.
Sure. So as a plumber, the buildup of plaque causes blockages in the arteries of our heart, and that disease process is called atherosclerosis. But that can happen anywhere. Buildup of blockage in the arteries of the neck is called carotid artery stenosis, which can lead to strokes. When it happens in the legs, it can cause a peripheral arterial disease. And so basically, those are kind of other areas that I focus in, specifically more in the legs. That buildup of plaque, as I mentioned, is PAD. People may have heard of it. And the symptoms that patients get is called claudication. And basically what that is, it's a buildup of plaque in the legs, so blood can't get to the muscles of the legs. So when we walk around, we get leg cramps, specifically in the back of our calves, maybe up on the thighs. It's worse when we're walking up hills or using the stairs. It's the exact same process that can happen in the heart. We call that angina. When we have a buildup of blockages in the arteries of our heart, we get a chest pressure when we're walking around because our heart needs more blood. We're not getting it because of the blockages, so we get this chest pressure. When our legs need more oxygen, but the muscles can't get it due to blockages in the arteries of the legs, we get claudication. So, and very much like the same treatments that we have for the heart are very much for the legs. Good heart healthy diet helps the heart, also going to help the legs. Medications, aspirin helps decreasing the risk of heart disease and also the peripheral arterial disease. And then we think about how we would go in treating them. Conservative therapy, such as our lifestyle, medications don't work and we get buildup of plaque in our arteries. If there's a blockage there, I do procedures to unclog those blockages called cardiac catheterizations. We could typically go through the wrist, go into the arteries of the heart, unblock those. Same thing in PAD. For now, we've been using the wrist to go all the way down to the legs. I can try to open those up with balloons or more advanced techniques. And then every once in a while, as much as we try to use minimally invasive techniques as balloons and stents, that's just not enough. And we need to invite our surgical friends in, and they would do bypass surgery. Just like sometimes you have blockage in the heart and it's too many blockages, stents aren't good enough. So we would use open heart bypass surgery, and same thing in the legs. And then the other thing I'll just mention is we've talked about the arteries of the legs. I also treat people with vein problems. So typically what we'll see is varicose veins. If everybody sees their veins, they say, oh, look at my veins. And that is a sign of what we call venous insufficiency or venous reflux. So basically what's going on is the veins are supposed to pump the blood back up to the heart, but there are valves that no longer are what we call competent. They don't touch as much, and so the blood can pool into our legs. We can get tired, achy, painful legs, leg swelling, itchy, burning, restless legs. And these are all signs of venous insufficiency. The way we used to treat this was in the operating room with a procedure called vein stripping, multiple incisions, not a very pleasant procedure, especially recovery. And now we've moved to very minimally invasive techniques, catheter-based techniques, where we can I do them in the office, maybe an hour door to door, no sedation. Depending on which technique we have, we can either use heat energy to close the vein. We can also use kind of a medical grade super glue to close it. And then it can really alleviate a lot of those symptoms.
That's good to know.
Yeah. So don't ignore your legs.
Don't ignore your legs. What role does age, gender, ethnicity, and genetics play in the diseases that you treat?
Well, definitely a large part. I mean, a lot of what you mentioned are unfortunately are non-modifiable risk factors. So, anybody who has a family history of heart disease at increased risk. The older that you get, we get older on the outside. We also get older on the inside, as does the heart. So this increases our risk of all the cardiovascular diseases that I had just mentioned. And then, of course, family history, genetics, all of that kind of plays in.
My family has a history of high blood pressure, and yet I don't experience that right now. But in a more general way, what are some ways that we can reduce our risk of cardiovascular disease?
Sure. So I get that question a lot. One of the things everybody wants to know is, how can I prevent cardiovascular disease? How can I not have a heart attack? I kind of equate that to it's like driving a car. And how can I not get into a car accident? The only way to not get into a car accident is to not drive a car. And of course, the only way to not have heart disease is to not have a heart. That wouldn't work out so well. But in that same analogy, if we drive the speed limit, use our blinkers, have our seatbelt on, then we're as safe as we can be. So with that same thought with the heart, it's generally what we call a heart healthy diet, which is we generally recommend the Mediterranean diet, and then increasing activity. Regarding the Mediterranean diet, we all probably remember our childhood. We have our typical food pyramid, and then all up top, we want to avoid the sugars and sweets. And then in the Mediterranean food pyramid, we're really trying to avoid is red meat. So red meat maybe once a month, more chicken, fish, vegetables, nuts, olive oils, those kind of foods to help decrease risk. And regarding exercise, we typically recommend, if you can, easier said than done, 30 minutes a day, 5 days a week, you're really trying to get your heart rate up. But it can also be, little things. I tell patients all the time, take the stairs instead of the elevator. I'll see people circling for 20 minutes at the mall trying to, park right up front, park in the back and walk. Even little things like that, increasing your steps, can really go a long way.
Doctor, we have been working from home for what seems like an eternity here in the midst of this pandemic. And so people who normally would get access to their health clubs, exercise gyms and the like, and now that the weather's changing and we're in the winter, what are some things that we can do at home that helps with heart health?
Sure. So, great point regarding initially first dieting. I hear a lot of people, because they're at home, they're near the kitchen, a lot of snacking. So again, trying to decrease those snack foods, or if we are snacking, maybe snacking on an apple versus potato chips. So kind of healthy choices in what we are eating when we're snacking at home. And then regarding, just trying to be more active. I think it's very easy to just sit in your chair for all of a sudden 5 hours go by and you didn't realize you haven't gotten up or done anything. Even in the office, you would go to the water cooler or go talk to a colleague. And people are really just sitting at home. So setting a little reminder every half an hour, an alarm goes off, you walk around the house, find some stairs, walk up and down some stairs. Just trying to put those reminders in so you can be more active, get around, and just like before, every little step counts.
With this approaching winter, and of course that brings snow in our area, and as often is the case, we jump right out there with our shovels and we just go right at it.
We do.
What tips do you have for us? What cautionary notes should we be aware of here?
Sure. So I generally advise against doing that. In that same light, if I asked you to wake up tomorrow morning at 5 o'clock and go run a marathon, you would look at me like I'm crazy. It's like, I mean, maybe, but I have to train for a while. Right. But then if I say, well, why don't you wake up at 5 o'clock in the morning and go shovel 2 feet of wet snow? Like, oh yeah, I just did that yesterday. So it's that same kind of idea. It's really this, we have to shovel the whole driveway. We have to get to work. So really, either if you can, not doing that, doing it slowly, doing it in phases. If you could have somebody else do it as, a plow, or even, snow blowers are better, if you will, than shoveling it yourself. But I do caution people, snow blowers themselves can be very heavy. So you got to be cautious with that. Trying to avoid as much show shoveling as you can. And then if you do have to do it slowly, do it in stages, do a little bit, take a break. And then a lot of times listen to your body. It will give you warnings that we sometimes don't want to listen to, but if we are starting to get a little short of breath, more than I thought I should, or a little bit of discomfort, this is definitely not the time to just push through it. Definitely want to pause, rest, see how we feel. And if we go back outside, we're shoveling some more, we're getting some more chest pressure, discomfort, or some more shortness of breath, then we are definitely done shoveling and we should be speaking with our doctor.
Let's go back to the interventionist part of cardiology. I've always wanted to know, what is the widowmaker? What actually happens when one makes that reference?
Yes. So there are 3 main arteries of the heart. One on the right side, the right coronary artery, which we say sometimes goes to the back of the heart. One on the side, kind of like a circle, we call it the circumflex. And then one that goes kind of the front, the left anterior descending, the LAD. And that is generally what we would consider as the widowmaker. And the reason why is that it supplies a large portion of the heart. And also when that one gets blocked up, that feeds tributaries or branches off to the electrical system. So kind of, again, playing the plumbing and the electricity together. When there's a major problem with the plumbing, just like in your house, that can lead to electrical problems. So honestly, generally when patients die from a heart attack, it's not necessarily always the blockage that's doing it in and of itself, but that blockage is causing a problem with the electrical system, can create a scar or not get blood to the electrical system, which then cause the electrical system to go out of whack, and your heart beating extremely fast, so fast that it doesn't pump.
Does it affect men, and is that why it's commonly referred to as the widowmaker, or are women equally as prone to this?
I would say in general, men are probably just more prone, but not, dramatically. Maybe 60-40. I think the thinking before had been it was, much more of a male disease. I don't see that at all, really. I think, unfortunately, the way we used to know what was going on when someone would have a heart attack is we would do studies and someone would have a heart attack, and then we would go back and we would ask them, well, what symptoms were you having? And they would say, I'm having chest pressure, it goes down my arm. And then if you actually look at those studies, 90% of the people in those studies were men. That's a very typical male presentation. Women can present that way as well, but women sometimes have more what we call atypical symptoms, which could honestly just be more shortness of breath necessarily than chest pain. It's also very important. Generally, if it's the heart, it's more chest pressure, kind of vague. We're not really sure where it is. Generally on the left side, it can go down the arm, can even go up into the jaw. I've seen patients who've been going to the dentist for months for jaw pain, and it was really their heart. So anything basically we think of above the belly button, generally more on the left side, it could be cardiac related.
So Dr. Denmark, let's talk about the different signs of a heart attack. Many of us have always, if you feel pain in the left arm, then something's seriously going on, or there's pain in the chest right over the heart area. But are there other signs of an impending heart attack?
Yes. So classically, it is going to be that chest pressure. It's kind of vague, radiating to the left side, down your arm, up into your jaw. But it really can be anything. It can be chest burning. I've seen patients who have heartburn and GERD when it really is their heart. one of the easier ways to help distinguish if you have chest discomfort, whether it's pain, sharp, dull, achy, burning, if it's coming from the heart or another organ, is generally heart symptoms are exertional. When you're at rest, you feel okay. When you're moving around or exerting yourself, the symptoms come up. That's generally because the heart is now pumping harder. It needs more blood. There's a blockage there. You can't get the blood and you get your symptoms. But not only is it just chest discomfort or pain, shortness of breath can also be a significant sign or symptom of a blockage. Sometimes when you're having a heart attack, people can get, nauseous. They just, feel, generally it's also associated with chest discomfort, and they feel a little short of breath and they get really nausea, may vomit. That could definitely be a sign of a heart attack.
Dr. David Denmark, thank you very much for visiting with us today. And we look forward to returning and having more conversation about cardiac health.
Anytime. It was my pleasure. Had a great time. Thank you so much.